headed over to see Bernadette, who is just east of Everett, Washington. She is a nurse practitioner, younger nurse practitioner who is providing care to patients in their home. We're going to be meeting with her at her clinic. We did just miss the opportunity to meet with her out seeing one of her patients, but that's okay. We know that a provider who goes out into the community, it's always very chaotic, hard to coordinate getting in there and seeing the action. But we can just chit-chat with her for a little bit, understand where she's coming from, what got her to where she is now, and what her aspirations as a nurse practitioner caring for people in the home is like. Hope to be able to connect with her and share the experience with you all.
Hi there.
Nice to see you.
Very good.
Thanks so much for your time. Greatly
Perfect.
appreciate it. I know it was last minute.
Yes.
But we're just briefly here in the Seattle area to really kind of understand how is it as a nurse practitioner to care for your patients. You're unique because you do house calls. So tell me a little bit more about your practice and how you got here.
So I opened my business because I found that there was a need. So as a nurse practitioner, I started working in a skilled nursing facility, and ultimately I would transition those patients home. And as I talked to patients at home, there was a disconnect. And so there was a need for me to feel that all the care that we've given in the hospital, in the skilled nursing setting, actually goes home with the patient. Yeah. To be able to translate to, this really worked, and we were able to capture and give the patient the best care that we can within that, without putting them in the community, I don't know what to do, back in the hospital, and kind of that loop. Yeah. So that's how I started, and I absolutely love serving my community. I'm a family practitioner, but I have an affinity to geriatric patients. I didn't get an opportunity to care for my mom when she passed away, so it's always for me a selfish need that I'm also trying to make sure that I can jump in and help and meet my patients where they are. Excellent. Yes. Excellent. Yes.
So when how long have you been a nurse practitioner?
So I have been a nurse practitioner a little over 4.5 years, and I was a nurse prior to that for 10 years. Okay. Yes, so collectively, nurse practitioner, 15 years.
Fantastic.
Yes.
And what brought you to this area? Because you're not from here originally, right?
No, I am not.
Okay.
So I'm initially, I was born and raised in Kenya, and then I moved here to go to college. And so I initially came here in Ohio and then transitioned to Florida. And that's why I did my bachelor's degree in nursing, and then I worked and had a family and raised my kids in Florida. And then I think everybody got comfortable. We got this comfort look, and I was like, we have to move. And so we decided as a family, Pacific Northwest was it. So we packed up and we moved up here. And
did you have any family here?
No, absolutely not.
Had you been here before?
No, we printed a map of US, and we closed our eyes, and 5 of us pointed at Washington, and we sold the house and moved. Yes.
Like that a lot.
We needed change. I needed everybody with a deer in the headlight kind of look, learning new things and not being comfortable. So we moved. Okay. Yeah.
Excellent. Fantastic.
Yes.
That's great. I like that philosophy.
Yes. Yes.
So tell me a little bit more. What is it a day in the life for you?
A day in the life for me is I wake up quite early in the morning. I want to be able to scan at my calendar. I want to be able to see the things that are ahead of me. And so in the morning, I spend time looking at my calendar, making sure I have a day set up. That's usually happen between 4 and 6 a.m. in the morning. Okay. And then I get myself ready and come to my office, where then I meet patients' need depending on what's on my schedule. I call my patients who I have previously seen, following up on them, just making sure they're hanging in okay. So my day is very flexible, moving, meeting the patients that I have for that day, as well as reaching out to the patients that I've previously seen in the week, and just following up. I also work very closely with the state of Washington DSHS. So I call their case managers and make sure all my needs are met as far as my patients. And then I'm usually in the office here until about 6 p.m. I go out in the community, see patients come back, go back and forth. And then I'm usually here until about 6 p.m., after which I retire home, walk for about a mile or two, I try, and then I hang out with my family. That's usually a Monday to Friday kind of day, yeah.
So you would say, I mean, I don't consider this work, this is passion, right?
Passion.
So how do you balance the family and your passion and all the requirements, you know, because it's dedication. How do you balance that?
So I balance that with having quite a strict regiment and schedule. And because I work for myself, I am very flexible in my schedule. So if my daughter had something scheduled, I would jump in and I'll open that time for me and my girl. I always pride myself in saying I don't have to spend so much time with my children. I just have to make the little time very quality. So that's what I do, so I don't have to deal with the guilty of not being present as a mom, and being able to balance and doing what I really love to do and making a difference in my community. Yes.
And how many kids do you have?
So I have 5. I've adopted 3, and I have
really?
2. Yes.
Wow.
Yes. So I've adopted 2, and I have 3 children.
And how old is the oldest?
So my oldest is in Washington State University, doing medicine. She's 19, and my youngest is 8.
Oh, fantastic.
Yes.
That's great.
Yes.
So it's a rich life.
It is.
Yeah.
I absolutely love my life. I couldn't change it for anything.
Yeah.
I love what I'm able to do as a parent. I'm a very flexible parent. And so I listen. I want to learn with my kids. I don't want to be dishing out rules. And then as I come here, I want to be able to meet my patients, and I'm able to accomplish those 2 things on the same time. And so I feel I absolutely love what I do.
Yeah.
Yes.
And it shows. I mean, it's very clear what you've done here is unique. And I think it does take a certain sense of risk, but I think you're the kind of person who likes taking risk. So I would, you know, I'm just fascinated by what you do because it's nice to meet like-minded people. There are plenty who could just go work in the hospital, go work for some large practice, but we've kind of ventured out on our own. And unless you do that, you'll never know what it's like, you know. And I'm 53 now. There's so many other stories that are out there just waiting, you know.
Yeah.
And when you go see a patient in their home, you see everything, every little nook and cranny and every opportunity there is to help them, which I think is amazing.
It's cliche when we say I want to meet my patient where they are, because when I walk into my patient's house, they're as vulnerable as they can in their own environment.
Yeah.
While I'm standing there, I can see something on the kitchen counter. I am assessing, I'm a microscope assessing everything. Because as a nurse, again, everything has everything to do with that patient. It's
Absolutely.
a holistic approach to care. And so as I step in their area, it's a much different concept than telemedicine. It's a much different concept than seeing them in the hospital, where they present differently. It's a much different concept than seeing them in a skilled nursing facility. This is just very raw, intimate encounter. And the patient is, you know, trusting me to be in their space. And so I don't ever want to violate that, but I also want to really just meet them where they are and provide them that care quality as best that I can in their own environment.
And that is your legacy.
Yes.
That's what you will be remembered for.
Correct.
You know, people will years from now say, oh yeah, Bernadette used to come out.
Yes.
And took care of mom, you know, and then the next generation, you know, it only feeds more. And your eldest is looking at medicine.
Correct.
Fantastic.
Yes.
That's great. Does she know what she wants to?
She's doing OB gynecology.
Really?
Yes. Yes, that's her niche. Yes.
Fantastic.
So I'm hoping that, you know, you never know. Yes. So.
Is there anything that you'd want people? It could be some minor thing that you know you've experienced in your life that was transformative that you'd want a viewer to kind of experience? Like what you're coming from it from culturally a different aspect as a female provider. You know, what would be some things that you would want a viewer to kind of?
I think I have to say, me standing here, I have 3 things on my desk, and one of them say faith over fear. And I look at that every morning because I think moving into this county, having this office in a predominantly white neighborhood was actually very fear eliciting for me. I had a very significant, even after being a provider for so long, I had a very significant imposter syndrome, where I felt like I can't make it, I can't do this, I can't believe I'm stepping out and actually taking this on, I can't believe it. And even times I'll go to open my doors, I walk in the office and I'm thinking, girl, just keep doing it. And a lot of it has been me saying, I surrender. I just want to be able to walk in and learn. I keep a very open idea of I'm learning every day. I'm going to continue to grow. And every negative things, every mistake is not a mistake. I actually want to know and learn and meet the best of my patient. I think for me, coming from Kenya, coming here, I was my worst critic. I continue to be my biggest critic.
Really?
I do. But I also find that as I'm getting older, I'm becoming a little bit more lenient with myself. I am becoming a little bit more lenient with myself, because I like to look at the rearview mirror and I see where I've been and where I've come from, and I see it as a stepping stone for every place that I am. And at first, when I moved here, I was intimidated. I'm like, no, but it's gonna come. We can't get any patient. And then the phone calls started ringing and we started showing up, and the compliment came and the patients were moved, and we're making a quality difference in our community. And then that, kind of just goes you. So I would always say, if you're on the fence, my best thing is do it scared. It's not gonna make sense. Oftentimes it won't, but as long as you show up and do the best that you can, and just give it your best, it will make sense. It's a stepping stone, and every day you look back from your rearview mirror and you're like, wow, I'm so glad I took a leap of faith.
So don't always play it safe.
Don't play safe. There's not good things that comes from playing it safe. Take the risk, make a mistake, learn. Every mistake is a learning opportunity. It's a learning curve. Do the best that you can. So at the end of the day, you can say, you know what? I was doing the best that I could at that moment, and my best changes from time to time. And awarding yourself the grace and the compassion to learn and keep growing. Otherwise, if you're always fearful and you don't take any risk, you stay stagnant.
And being stuck in a clinic or a hospital, you're not taking any risk. You're just sitting there, just pushing the time clock,
Yeah.
Yeah. And
I have a lot of my friends that I've called after I started this place, and I'm like, you have to stop. So I have 4 of them that have opened their own clinics.
Really?
After I opened my clinic, yes. And I was like,
Back home?
No, here.
Really?
Here, I have one yes, I have here in Washington State. And they call me, they're like, I don't know what I'm doing. I'm like, that's fine. We all don't know what we're doing. Yeah. We just learn and we meet our patients, and our patients don't really care what we know as much as that we care.
Yes.
And what I don't know doesn't sleep unknown. I will go home and I will learn it, I will find it, and I will make sure that I can meet my patient's needs. Yeah. So it's not being so critical with yourself with the knowledge, other than we're in a caring environment and people are hurting and they need somebody, and I can show up and fill that void anytime. Yeah.
That's important.
Yes. Yes, great. Most definitely.
Fantastic. I'm just staring at the massage chairs.
You can have a seat for one of them. And I would also like, as I talk, one of the things I love to actually talk a little bit about, and that's why I kind of landed into this, is IV hydration.
Yes. You're
familiar with IV?
Yeah. Oh, yeah. I do.
So I love that, because most of my patients go back to the hospital from dehydration. Yeah. So I'm able to actually go home to them and do an IV hydration. And so I've done that a lot in some geriatric patients.
Okay.
Obviously with an assessment and ruling out. There we go. And then you just click the power button. You got this.
Oh, push the power button.
There. And it does its thing. There you are.
All right, go on.
Yes.
Do your thing.
Yes. Okay, so here in the clinic, I particularly spend a lot of time in the community, but in the clinic, especially with the COVID pandemic, we have implemented COVID testing, COVID vaccination, COVID antibody testing. So here I have set up for COVID testing, so where we can serve 2 patients at a time, good distance apart. We have all the equipment that we need here for the testing, as well as we take a quick temperature, oxygen saturation. I do an assessment on the patient to make sure that the patient's okay, and take the pride and joy to educate them about COVID and vaccination during my encounter with them when they're here in the clinic. Also here, I do IV hydration. So that's where we're hanging out here. You come in, you get on a recliner chair, you do some me time and self-rejuvenation, do some IV hydration therapy, whatever cocktail. So we do a different set of cocktails, from hangover cocktail to immune boost cocktail to performance empowerment cocktail, mental health cocktail, different sorts of cocktails that we do, and that we do here. Then we have our reception that usually we set up at the front. We're here all day long, actually. We're usually here until about 6 p.m., sometimes until 9, depending on what our day looks like. And that's a wrap for the front. So every so often, I have a patient, especially one of the things I address is anti-aging and hormone replacement therapy for my patients. So I have this area set up where I can do an assessment one-on-one with the patient. And so we hang around here and discuss intimate details about the needs that I would like to meet them. Those are the patients that do come to me in the office. Otherwise, I'm in the field talking with them and talking to my patients majority at homes. So this is that setup. And yeah, nice and simple, and we just hang around here, get to talk to each other and know each other a little bit more and be a little bit more intimate, just so I can be able to step into their life and help the best that I can. Yes. So I'm going to take you to my miniature lab that I have here in the clinic. So one of the things, especially doing house call, I want to be able to do IVs for patients at home, as well as get their blood work done. My patients are mostly homebound, so to be able to get somebody going out to them sometimes have been very tricky. So as a nurse practitioner, I always jump into the role of grabbing the blood, and then when I come to the clinic, I'll get the blood ready and set up. So I'll walk you through my miniature lab. Back straight on. And this is that area. So I will bring my lab here, and I'll process all the labs that I have, spin my blood work, and then I send it out to an awesome company in Florida called Access Health that processes all my labs and get me my results within 24 hours. And in here I have my COVID vaccination storage space as well. I don't have vaccination at the moment, but I do have COVID vaccination storage space as well. And that's good.
To find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything. We're happy to entertain it, and this is really about us going on a journey together.